Communities across the country have been dealing with a spike in measles cases. Canada has one of the lowest child vaccination rates among developed nations. The federal Minister of Health was asked today about dealing with so-called anti-vaxxers.
It's very alarming, I have to say, but as the health minister, my priority is making sure that we get credible information out to Canadians. When we talk about the importance of having our children vaccinated, we have to make sure that Canadians are aware that the information that we're giving to them is based on scientific information. And we want to make sure that we provide them with credible information so that they make the appropriate choices, and we encourage all Canadians to get their children vaccinated.
The latest city dealing with the measles scare is Ottawa. Health officials have been in contact with close to 300 people who may have been exposed to the virus in the past 2 weeks. The city is now investigating 2 unrelated cases of measles. In both cases, the adult patients contracted the disease while traveling abroad. Robin Miller is in Ottawa with the latest. So, Robin, what do we know?
Well, since these cases were confirmed, Ottawa Public Health, the health authority here, has launched a health campaign to try and find the hundreds of people who may have come in contact with the 2 people infected. Because, of course, before their cases were confirmed, they were just going about their daily lives, visiting shops, restaurants, grocery stores, and hospitals in the city. So they may have come in contact with quite a number of people. Now, we know this virus is severely, highly contagious, and that infected surfaces can remain contagious for hours after exposure. Now, OPH is saying that when they find the people who may have come in contact with the virus, the first thing they're doing is checking their immunization status, and that's going to help them determine what steps need to be taken. They could include that person having to have another vaccination, a booster shot, or simply waiting and seeing if they develop any signs or symptoms of measles, which can develop anywhere between 1 and 3 weeks after exposure.
So what kind of impact is just the news of the measles having on the city?
Yeah, well, it's having a pretty big impact. You know, people are certainly more aware of what's happening. It's been in the news for a couple weeks here, and of course, with outbreaks happening elsewhere in the world, people are, I think, more aware for sure. They're a little bit anxious. In fact, parents seem to be wanting to vaccinate their babies before they're 12 months old. One doctor I spoke to said that her office has been getting at least a dozen calls from anxious parents who don't want to wait until 12 months to vaccinate their kids.
Presently in the Ottawa area, we have not changed our ways of yet with regard to how we're immunizing if they are staying in this area, unless they are immediately recognized as being in contact or potentially at risk in contact.
Now, Little says in those cases, children who are over 6 months of age may get an early vaccination, but that will be considered an extra dose, and that they'll get another dose when they are 1 year old and another booster shot at 4. Of course, symptoms of measles include a cough, a fever, tiny white spots in the mouth, and that blotchy rash that you've likely been seeing in all these pictures. Health authorities here are saying, you know, if you feel ill or if your child feels ill with any of these symptoms, to isolate yourself or isolate them and call your doctor's office before heading into a hospital or clinic in an effort to protect other patients just in case they do in fact have the measles.
Robin, thank you. The CBC's Robin Miller in Ottawa. I'm joined now by Dr. Sarah Wilson. She's a physician with Public Health Ontario, and thank you very much for coming in. So as we just heard, Dr. Wilson, in Ottawa, health officials, they're reaching out to these 300 people who may have been exposed to the measles. How important is it to track them down?
I think it is important. I think with measles, there's a couple key points to keep in mind. It's incredibly infectious. It has important complications, and the people who are at increased risk of complications are many times those who can't be vaccinated. So babies under 6 months, pregnant women if they're not previously protected, and immunocompromised people. So there are some things that can be done if contacts are identified. Vaccine can be offered, and for those groups that I mentioned that can't be vaccinated, there is a product called immune globulin. So giving measles antibodies from other people in a blood product. So that can be used to try to prevent measles infection if it's given within a very narrow time frame.
How serious is the measles?
So measles is an important illness that is associated with complications. So the most common complications in about 10% of people, it's associated with ear infections and severe pneumonia. But of course, what we're most worried about are the more rare complications that are incredibly serious, like encephalitis or even other neurological disorders that present many years after the original diagnosis of measles. So those are obviously very concerning complications. But measles is an important illness, and I think the key message is that it's preventable. And so I think whenever we hear about measles cases, we really need to emphasize that measles is an important illness that can be prevented through vaccination.
And then when you hear about anti-vax, so-called anti-vaxxers, those who don't want to vaccinate their children or have just not been themselves for a variety of reasons, as a health professional, what do you think?
Well, I think it's obviously very troubling when we think about groups and individuals who aren't accepting of immunization. But I think the majority of parents in Ontario do support immunization, and I think we do see that in public reactions to stories about measles, just like your most recent clip, parents phoning their pediatrician. So I think we also have to remember that many people support immunization. Vaccines are safe, they're effective, and they're needed. Measles circulates across the globe. We're just very fortunate in Ontario, just like the rest of Canada, that we've been able to eliminate measles infection.
When you look at what happened in New York City just the other day, where the mayor basically said this is mandatory, you have to get vaccinated, and if you don't, there will be a fine or there will be repercussions. What do you think about measures like that? Is that the kind of measure that you would, as a health professional, support if the situation got to be worrisome?
I think that's a great question, and I think it's something that public health officials really wrestle with. I think there's no question that the traditional approach, whether you're a health professional working with patients directly or a public health physician speaking to communities and populations, that we really prefer to emphasize the safety, the effectiveness, and how important vaccines are before we start thinking about measures that talk about the words of mandatory or requirements.
Now, Canada does have one of the lowest vaccination rates in the developed world or in the Western world. Why do you think that is? Is there a problem in terms of getting the message out about the importance of immunization?
That's another really great question that I think, I think we can do a lot better in Ontario and in Canada. I think another challenge is with our tracking systems for immunization coverage, and we need to also make some improvements there so that when we're thinking about how do we do better in terms of increasing immunization coverage, that we're actually confident that we have the correct measurements.
What are the symptoms? So if these 300 people who may have, is there anything that they should be looking for?
Yes, so the most common symptoms of measles are cough, runny nose, red eyes, and fever. And the challenge is that those are pretty nonspecific symptoms. So those nonspecific symptoms people will have for a couple of days before they develop the classic rash. And that's one of the reasons why measles is so infectious. People are starting to feel unwell, but without the rash, they're going about some of their activities. They may see a healthcare provider to look for a diagnosis, but because the rash hasn't yet appeared, the clinician might not be thinking about measles. But individuals are still infectious during those symptoms before the rash appears, and that's another challenge for measles control, that individuals are infectious for quite a long period, and because it is so infectious. Someone with measles, if they walk into a room and then leave that environment, measles virus can stay suspended in the air for up to 2 hours. So it's an incredible...
Just in the air?
Just in the air. So that's why it's such a challenge in terms of measles control. It's incredibly infectious. But again, we have a way of preventing measles, and it's through vaccination.
When you look at that rash, it just looks like, it looks painful. Does it look more painful than it actually is? The rash itself?
I'm vaccinated, so I haven't had that personal experience. But of course, the rash does look quite...
And measles itself, it can be worse than the flu in terms of the feelings in your body, right?
Absolutely, and that's why, that's another challenge in terms of how infectious it is that people, when they develop those early symptoms, they tend to go see a healthcare provider because they're just feeling so unwell. And many times individuals are hospitalized with measles, which also is a challenge in terms of thinking about exposures to vulnerable patients like people with suppressed immune systems.
So what advice do you have, this is interesting, what advice do you have for a parent or another person who's concerned or hesitant about vaccination, whether it is being against vaccines or concerned about vaccinating their child too early? What would you say to a person who's concerned about that?
Vaccines are safe and they're effective and they're needed. Measles circulates all around the world, except we've been very fortunate to eliminate it in Canada. The cases that we're seeing in Ontario, as well as other high-profile cases and outbreaks in other parts of Canada and in the US, are a reminder that measles isn't just an infection in a faraway place, that measles comes to Canada, it comes pretty regularly, and that vaccination is really your child's best chance at protecting themselves from an important illness and with important complications.
Dr. Wilson, good of you to take the time. Thank you very much.
Thank
Dr.
you.
Sarah Wilson of Public Health Ontario with me in studio.